Great. Thank you for that overview, Claire. And as you were speaking, a number of people were dropping in the chat box their organizational values which support health equity, and I'm seeing some really great resonance. The kinds of values people are sharing, so I'm seeing things like respect, integrity, collaboration, honoring diversity, integrity, commitment, and I think they really resonate very nicely with some of the values which you just spoke to earlier. So our next question for you as we move forward, so our next half of the presentation is going to focus on a bit of how organizations can start to shift values. So I'd like to know from you, we talked a little bit about our personal values. Claire just spoke to us about values at an organizational level. So our question for you is, do you have the same professional and personal values? Are these the same? Are they different? Does it change over time? Okay. Thank you. So this is really interesting. So no one is saying no. No one is saying no to the question. About 60% of people are saying yes, I have the same values, and about 40 are saying sometimes. So that's really interesting. Thank you. All right, so it's great to see that. The comment I want to make on this is that we actually all have one set of values. So whether or not the values get expressed consistently in different contexts, we all have just one value. And I think in one of the examples which we'll talk about this idea of value tensions in values. What happens when we may find ourselves in organizations where the values we're bringing in are not necessarily the values the organization has, or the values which are being expressed in practices. So thanks for that, Ashwar. Great. So I'd like to spend the next few minutes talking about how we can start to shift values. So typically, organizations usually have stated values, and we've seen some really great examples there. So if you're an organization interested in actually actively shifting your organizational values, what the literature suggests is that for most of the times we are asking questions about organizational culture. And organizational culture is really simply a system of sort of shared symbols and meaning. So this is what is shared at the organization. We can think about culture in two different ways. We can think about culture as just what the organization is. So it's a bit loose, it's a bit amorphous. We know it exists, but we can't quite put our fingers on it. Or we can also think about culture as what an organization has, which means that if we can actually identify what organizations do, then that is where we can actually start to shift. So one view says culture is what it is, and we can't really identify it. And if we cannot identify it, then we can't do very much about it. While another view, which is the view we really focus on, is that organizational cultures are actually things which we can craft, cultivate, and shift over time. And so the ways to do this there are some systematic ways to do this. As we were doing the scan for this initiative, we did not find any sort of tools or assessments which focus specifically on organizational culture or values for health equity. But we did find some which we think would be useful to our work in public health. So we did identify 3 tools which can help you assess your organizational culture. The first is the Denison Organizational Culture Survey. The next is the Organizational Culture Profile. And the last is the Global Leadership and Organizational Behavior Effectiveness Survey, also called GLOBE. There are links to all 3 in the slides, and you'll get which you all received. So I'm going to spend a little bit of time walking us through the very first tool, which is the Denison Organizational Cultural Survey tool. So this tool has been widely used in different settings, and it has been used in health settings. So I think it's an interesting one for us to focus on a little bit. The reason why I love this also is that you actually have a facilitation guide available, so there's a very nice description of how you can implement this tool in your own context. So the Denison Organizational Culture Survey is a tool which is designed to measure the assumptions, underlying beliefs, values, and attitudes of people within an organization, and also engages people around the practices and behaviors which exemplify the values, beliefs, attitudes which you would want to see. It has two dimensions, one which focuses externally and another which is internal. So externally, you're looking at things around adaptability and mission, while internally you're looking at consistency and involvement. The tool itself is a 60 survey item. So in terms of adaptability, here we're asking questions about how the organization is able to respond to the external environment and the extent to which and how flexible the organization is. The questions are related to change. So for example, you can have a question which is about how flexible the organization is or how amenable to change the organization is. Or how people within the organization adapt to change. So when there are change initiatives, are they usually met with resistance or not? So that gives you a sense of the environmental context within which you're operating in. There are also a number of questions which are related to sort of a customer focus, or which in our case I think would be a community focus. A lot of people as you shared your organizational values, talked about collaboration and honoring diversity, listening to community. So to what extent does your organization actually do that? So is feedback from community actually influencing what you do directly? So do you have questions related to that? The last piece there relates to learning, and I think when we're thinking about organizational capacity and shifting what organizations do, the ability to learn and adapt to a new environment, to new information is really important. So even in our own work as an organization, we've really emphasized the importance of learning as a way to create and sustain change. The next box deals with, again, which is externally focused. This deals with the organization's mission. So here the questions are really designed to get a sense of do you know where you're going? So is there a common understanding of where the organization wants to go in terms of goals and objectives? Are these goals clearly articulated? Are leaders within the organization articulating this goal? So in our case, we would want to ask questions about the extent to which health equity goals and objectives are being articulated by leaders within the organization. So internally focused, you'll see that under consistency, that is where values in this particular survey shows up very, very clearly. So the questions here relate to how defined values and systems are, and the values and the organizational systems really form the basis of a very strong organizational culture. And so you'd want systems in place which create opportunities for people in the organization to act in ways which are consistent and coherent across the organization. And is there a level of agreement that, in this case, health equity is part of what the organization needs to be doing in the first place? Also in the internal domain are questions around involvement. So here we're looking at the extent to which people within the organization are involved in everyday decision-making and in everyday action, so in those day-to-day activities which will then support health equity. And so you're looking at things around empowerment, the orientation of the team, how decisions are made within the organization, and also how the organization supports people within to develop their own capabilities. So this gives you a sense of some of the survey items. The facilitation guide itself will give you a clear sense of the questions here, which I think can be adapted to meet our needs for health equity capacity. And all this happens in the context of a full process where you use the survey data to assess the current state of the organization, and then move towards a conversation which is designed to create an understanding of the strengths and weaknesses within the current culture. And then there has to be this very active decision to actually shift the culture in the direction you want to go. It's followed by planning for action, as well as implementation, and then evaluating where you are as an organization. So as I mentioned, there were two other tools we reviewed very briefly. The other is the organizational culture profile, which has 7 dimensions, which you see on the screen. And the third is the global leadership and organizational behavior effectiveness survey, which this last tool is a tool which really looks at how organizational leadership is influenced by the societal context within which the leader operates. So I think it provides a different lens to the conversation. So for people interested in leadership and how societal influences impact that, this would be a good tool to look at in more detail. So I'd like to pause here and ask another question. So Claire talked about organizational practices and policies which reflect health equity, and I just reviewed a tool which can help us engage in some discussion about how we shift values. So we'd like to know from you, does your organization actively engage in activities to shift values and to align the organization's values with behaviors, so with organizational behaviors? And if you're saying yes to that question, we'd love to see some examples of how you're doing this within your own context. All right, great. So a number of people are saying yes, this happens, about 40% of people. So for those 40%, please share with us how this is going on within your organization. And a few people are saying no, about 20%, and similarly, a number of people are not sure. So we're really interested in hearing how you're doing this within your organization. Okay, great. So I'll just read some of the responses which are coming into this question. So we're hearing from people in the chat box that within organizations this is happening through capacity development. It's also happening around a value of accessibility, and so shifting practice to add access for wheelchairs and people who are differently abled. So we're also seeing competency development, coaching, training. Great, thank you. So thank you for sharing those examples of how you're actively engaged in shifting values within your organization. Okay. So in terms of shifting values, what we saw is that organizations tend to take a couple of different approaches to shifting values. So the first is it could be sort of top-down. So the leader says, this is our value and that's it. So this is who we are as an organization. So it comes from, the leader. There's also the sense that it can be spontaneous. So there is no active discussion of organizational values, but it's just we acknowledge the fact that as an organization, people come in with different values and that over time that will just shift. And then the last has to do with actually engaging in dialogue across the organization, leaders, staff, community members, to say who are we as an organization, what are our values, and how do we align our policies and practices to reflect those stated values. I think for our work in health equity, that last bit cannot be stressed. Claire talked about the importance of an active discussion and discourse around values, which really align very nicely with this last point. So what we see across some of the assessments we looked at, we see some things which are consistent in terms of shifting strategy. I think consistently in terms of shifting values and culture, it's really important that leaders model the behaviors which are desired within the organization. So for organizations interested in shifting values, it's important for staff to see that leaders are actually living those values within everyday practice. Communication across the organization is also important. So really developing this compelling story for why the change is required. And also the risk of not changing, which has come up very frequently in our learning circle discussions. A number of people talked about spending time building capacity of staff, which again is critical. So really supporting that skill building so staff are actually able to then implement the desired change, as well as developing the systems needed to sustain change. What seems to happen most is that a lot of organizations typically start with skill building, and we saw those great examples in the chat box, and then tend to get to building support systems a little bit later. So there could be some better alignment within across the board to really trying to align those things at the same time. And it seems that role modeling, so the ability of leaders to role model the desired behavior, it seems to be an area where a lot of organizations actually struggle a little bit more. So we've talked a bit about the importance of actively engaging in a dialogue across the organization about values. And I know someone in the chat box just shared that there have been some team discussions. So what we thought we'd do here is just share a quick process for how you can do this. So the reference to this is in the reference list. And this process can be done in about 2 hours. And it's really important that, leaders are part of the conversation, managers are part of the conversation, staff are part of the conversation. And so really bringing people together and having that active conversation. So assuming that you have spent some time actually thinking about your organizational values, and you have values which are stated which support health equity action, then you can engage in a conversation, and it's always important to have some guidelines which support sort of authentic engagement, and go through a process where you list these values across. Imagine yourself in this room, and you list the values, and spend some time thinking about if integrity is a value, how does what behaviors support this value? And just spend some time listing all those values and giving people a chance to reflect on the values and the behaviors which have been assigned to those values. You can then spend some time coming up with themes, and as you have those themes, the next stage would be a reflection on whether or not those values, the behaviors which you want to see, actually exist within your organization and within your culture. And do those behaviors and practices actually support health equity or not? And there has to be this willingness to commit to long-term action and also building in accountability, check-ins. And we talked a bit about the importance of really having the support system. So are these things being built into performance evaluations, into our regular check-ins between staff and managers? After a discussion like this, it's really important to then develop a clear idea of how these behaviors are going to be integrated into the organization following a discussion like this. So you can read more about this in the reference there. It gives you a really nice outline of how to go about this. And I think we may be testing this out within our own organization so because we are in the process of talking about our organizational culture, so it's a really timely tool for us to be discussing.